All right, everyone, welcome back. I hope the first part of the episode left you feeling a little more prepared and a lot less intimidated by dental emergencies. There's still more ground to cover, so let's keep going. These next situations are ones I see often, and knowing how to handle them can save you pain, time, and sometimes even the tooth itself. Let's start with something that surprises people all the time: a lost filling or a crown. You might be eating something sticky or chewing on something a little too hard, and suddenly it pops out. When that protective layer goes missing, the inner part of the tooth gets exposed. That area is much more sensitive, and nerves that have been sealed off are suddenly reacting to air, cold drinks, and even your breath. Your immune system also responds right away, sending cells to the area and creating swelling, which only adds to the discomfort. If this happens to you, the first step is simply to keep the area clean. A warm saltwater rinse is always a good idea. You can cover the exposed spot with temporary dental material from the pharmacy, or even a bit of dental wax until you get to your dentist. Pain relievers can help, and in some cases, even something simple like a bit of clove oil can provide short-term numbing. But once that filling or crown is out, bacteria have an easy path back into the tooth, so it's important to get professional care as soon as possible. Now let's talk about orthodontic emergencies. If you've ever had braces, you know that wires can snap or shift and brackets can come loose. When that happens, the wire can poke the inside of your mouth and make it really uncomfortable to talk or eat. The soft tissue gets irritated fast and starts to swell, and tension in the braces can shift in ways that affect your treatment. If you ever deal with a poking wire, orthodontic wax is your best friend. It creates a smooth barrier so the wire doesn't keep rubbing your cheek. Rinsing with warm salt water helps keep the area clean and eases some of the irritation. For discomfort, people often reach for acetaminophen because it calms the pain without affecting bleeding the way some other medications might. Still, the real fix comes from your orthodontist. As soon as you can, schedule an appointment so they can reposition or repair whatever came loose. Avoid adjusting anything yourself. Braces look simple, but the pressure they apply is incredibly precise. Another issue that deserves attention is dry socket. This usually shows up a couple of days after an extraction, especially wisdom teeth. What happens is that the protective blood clot in the socket gets dislodged too early. Without that clot, the bone and nerves underneath become exposed, and that pain can be intense. It often radiates up into the ear or down into the jaw. The goal at home is to keep the area clean and avoid anything that might disturb the socket. That means no smoking and no drinking through straws, since both create suction. Sometimes dentists prescribe a medicated rinse or place a soothing dressing inside the socket to calm everything down. This is one situation where you don't wait it out. If you suspect dry socket, call your dentist. Another emergency I see often is pericoronitis. This happens when a tooth is partially erupted, usually a wisdom tooth, and bacteria get trapped under the little flap of gum that sits over it. The gum gets swollen, tender, and sometimes even starts oozing. Chewing becomes difficult, and your jaw can feel tight because the surrounding muscles tense up to protect the area. Warm salt rinses are really helpful here because they flush out the bacteria and food particles trapped under the gum flap. Anti-inflammatory medication can help, and sticking to softer foods for a day or two makes eating more comfortable. But again, this is something a dentist needs to evaluate. Sometimes the gum needs a deep cleaning, and sometimes the tooth needs to be removed altogether. Next up is something called cracked tooth syndrome. These cracks can be so thin that they're almost invisible, but they open up just enough when you bite to irritate the nerve inside the tooth. The interesting thing is that the pain often hits hardest when you release your bite, not when you clamp down. Over time, bacteria can work their way through the crack and cause deeper issues. If you suspect a cracked tooth, try to avoid chewing on that side. A cold compress can help with swelling, and over-the-counter pain relievers can take the edge off. But diagnosing a cracked tooth usually requires a dentist because the cracks can be tiny and tricky to find. The earlier it's treated, the better chance we have of saving the tooth. And that brings us to the end of part 2. Thanks for joining me today on Smile Sessions. I'm Dr. Tony, and as always, I'm here to help you keep your smile healthy and strong. If you have questions or topics you'd like us to explore in future episodes, send them our way. Take care.